Hi, my name is Ron Emerson. I'm the Global Healthcare Lead at Zoom. I've been in telemedicine for about 25 years. I'm a nurse. I used to be the executive director of a telehealth network up in the northeastern United States. Was on the board of the American Telemedicine Association, and then have had the opportunity and privilege to provide and work on telemedicine programs in 46 countries. So what's an important topic in telemedicine? I would have to say, for me, the most important topic, of course, we always talk about reimbursement, but as we move more towards a value-based system, is incentivizing healthcare organizations to use virtual technologies and telehealth as a means to be able to provide value-based care. I think the most common impact that we all see is just the increased utilization of telehealth. Pre-COVID, I think we'd all know from data that when you look at video-assisted virtual visits, it was less than 3% of those who could use it did use it. Out of necessity, we moved towards telehealth as a way to provide just general everyday care, general ailments and follow-up care, mental health. So I think that movement and that exposure of clinicians and of patients and exposure to the technology is going to really sort of set this new trend of how we provide care in the future, increase the utilization when it makes sense. This is a great question. So what does telemedicine look like in 2 to 3 years? Where I hope to see telemedicine is where it's not just related to a fee-for-service bundle. It's just incorporated into more of a value-based sort of capitated rate care system. So we allow healthcare providers to use the technology when appropriate based on the clinical need to provide the best clinical outcomes. That's one area that I see. I see it as far as standardization and best practice models and being an important part of that, where we have inclusion, exclusion criteria for when to use, when not to use, so telemedicine doesn't get a black eye or a bad name. I think that's very, very important. And where we have it just being health, where it's not telehealth, it's just health, and it's just part of the way that we receive our health care as part of organizations, and as part of the way we provide health care as part of organizations, and the way we receive it as patients. And I think last but not least is where we actually have, and we're starting to see this, where when you have executive staffs in healthcare systems and payers and the providers, where it's just from a top level down, just how we do day-to-day sort of say business, I guess, and it's an embedded delivery model of how we take care of our patients. My name is Ron Emerson, and telehealth is health.